Good afternoon. I'm Michael Friedman, and I am the volunteer chair of the Cognitive and Behavioral Health Advocacy Team of AARP Maryland. And welcome to the first show that we're having in our live stream presentations on your mental health. Hopefully, this will be the first of many such presentations. And we have with us a terrific guest to kick off this series. Thomas Cudjoe is a physician, and he's a public health professional, and he's an expert on geriatrics and gerontology and internal medicine. And most importantly, for our topic today, he's an expert on social isolation and has written a number of articles, including one that we'll give you information about at the end of this, about social isolation during the pandemic. That will be our topic for today. Obviously, there have been terrible physical consequences of the pandemic, which make frequent headlines. But in addition to that, there's been significant psychological fallout of the pandemic. People have experienced grief, premature death, and the reaction to that, fear, the economic dislocation that some people have experienced, even the vast pressure of, I think about working moms, grandparents raising children. There are just a whole host of emotional reactions to the pandemic. And one that's become particularly clear is social isolation. Dr. Cudjoe is an expert, so take it away.
Yeah, well, first I'll just say thank you for that generous introduction. And thank you, AARP Maryland, for taking the time to spotlight this issue and for us to have this conversation today. This is an important issue. It's an important issue that I think has gained increased awareness during this pandemic, but we both know that AARP, fortunately, has been trying to create awareness around isolation and loneliness for many years now, prior to the pandemic. In speaking directly head on about the psychological fallout, as you put it, and I think that this is social isolation and loneliness is a major source of distress. And I think early on in the pandemic and even continuing today, the distress associated with this hidden condition at some level, being unclear about who had the coronavirus, it being a contagious condition, a condition which we've seen high levels of mortality from. These are all circumstances that has caused anxiety, anxiety to the point that people have been concerned about interacting with their loved ones, their family, their close friends. And then even early on in our pandemic, the lack of understanding of what can prevent, what can I do to protect myself from the coronavirus beyond distancing ourselves from one another.
Well, the distancing, just to interrupt, the distancing is something that needs to be done in order to protect against contagion, but the distancing also has, as you've pointed out in your article, the result of isolating people.
Exactly.
And that has significant consequences too.
Yeah, so that, getting at the distancing, so, we know these protective strategies, the masking, the distancing, and so it is important to acknowledge that this distancing, though we think about its protective nature in terms of preventing the spread of the coronavirus, this distancing also has its impact in terms of how we engage with people who we've known and loved and regularly spent time with it. And so that has a psychological manifestation, I think, as well, in our inability to relate to people in the way that we normally would. And so that's been one of the, I think, important things, and also things that I think we've all struggled with.
One of the things that I think about is the isolation in nursing homes. The problem of contagion in nursing homes has been terrible. And the solution has been essentially to lock people in their rooms, and people who at least had the company of other people in the nursing home got cut off from that, as well as cut off from families and friends. That must have had terrible consequences.
Yeah, these institutional settings, I think our nursing homes, even our hospitals, assisted living facilities, many of these congregate facilities have, to prevent contagion in the congregate setting, in the initial times of the pandemic, really locked down at a level where people who were in an institutionalized at some level couldn't engage with their family or friends or others outside. And so some institutions or organizations responded in different ways, but many of them responded by locking down. I think we did see different institutions or organizations approach this problem or challenge in creative ways. Some provided drive-by visiting. Some provided visitings through windows. People tried to figure out ways, how could you do things to bring residents or people who were in these settings together in a way that would mitigate the spread of the coronavirus. And, we also have leveraged technology in ways that I think, hadn't before, to figure out how to support people in their connections.
Well, I think that's very interesting. We've got this terrible tension between protecting against contagion and protecting people from the damage of isolation, which I'm sure you'll want to say some more about. But we also have this really inventive reaction that's taken place during the pandemic. It hasn't been all, oh my goodness, there's nothing we can do. People, as you say, have come up with inventive responses to this.
Yeah. So you and I both know that social isolation and loneliness was burdensome to many individuals prior to the pandemic. And that burden is such where we know that it leads to certain morbidity and mortality. So various mental health strain and physical health strain, so much so that, like I said, people, we know from epidemiologic evidence, people who are socially isolated or lonely have higher levels of mortality. We also see that there's higher levels of cognitive decline, higher levels of depression, and higher levels of worsening cardiovascular disease. All these things we knew prior to the pandemic. And so to say that the current pandemic had an impact on these existing social isolation and loneliness, I imagine it did. I think the evidence will show that as time progresses. So the approach that I think many people have taken to balance the risk mitigation of the coronavirus, as well as trying to support people in their social connections, has been one that I think certain groups, certain communities have approached it in ways that I think we can laud in terms of their creativity and trying to figure out how to best support people, while I think some communities have not necessarily navigated that in a way that I think has supported all the people in their community in the best way.
Can you give some examples of, you mentioned in nursing homes there were drive-bys and talking through windows and the use of telecommunications for people out in the community?
Yeah, so I think here locally, it was great to see people come together at, public and private entities come together in the Baltimore Neighbors Network. I think that effort here led locally was one in which we contacted, or the individuals who were involved with that effort contacted people through the use of phone to understand at a periodic basis how were they doing during these times, as well as connect them to concrete resources in the community. And some of those resources, I think, were for mental health supports, and some of them also were for other type of important supports that were needed during these times.
Yeah, that was a particularly interesting effort. They recruited many volunteers to make calls to strangers, and they had pro bono counseling backing it up, so that if somebody exhibited some mental health problems, they could get a mental health professional involved.
Yeah.
To help them.
So I think it was a great response considering our times, but I think it makes us it makes me think, what can we do to have an ongoing and lasting impact to so that people can have those supports in times where we're not essentially in the pandemic. So I think that, that response was valuable for what we had. But I think that you really want people to be nurturing and supporting connections that kind of already exist. I think developing new connections with people considering the crisis can meet a certain need. But I also worry that we want people to really have connections that from individuals that they trust, that they feel like they can go to on a regular basis, and not something that's kind of reactive that I think we all had to deal with considering these current times.
So I, of course, need to put in a plug for AARP's Community Connections, which was a really interesting, and still is, of matching people. It's almost like computer dating. People sign up who want to get a call from somebody, and people who want to make a call sign up. And so that's another interesting effort. But you just emphasized the importance of having connections with people So part of what's happened is that the houses of worship particularly have organized efforts to reach out to the people who are members of their congregations. Senior centers have begun to do that. And I wonder how we can continue these efforts to build connections. As you said, this problem existed before the pandemic, and I'll add, it's going to exist afterwards. Some of these lessons maybe we can carry forward. I'm talking too much as the interviewer, but let me interrupt a second just to say to the audience, if you would like to ask questions of Dr. Cudjoe, please go to the comment section and put them in, and we will try to get to your questions. I'm sorry I gave a long speech. So
No. I think that these resources, and I think that the community response that has occurred is critically important. I think that sustaining them will be one of the ways that we mitigate this pandemic of social isolation and loneliness to be mitigated with time. We know from my own work that about 1 in 4 older adults were socially isolated prior to the pandemic. And we suspect that these levels potentially could be higher and more burdensome following the pandemic, or as we transition, hopefully, out of it. I think that we think about, what are some of the things that lead to this change in people's lifestyle and behavior that potentially put them into social isolation. So I think these pandemic times, potentially people who were not isolated before have become isolated, and they will remain isolated after the pandemic if the proper strategies aren't put in place.
I find that very interesting. It's interesting to try to understand why people were isolated before the pandemic. During the pandemic, they were forced into isolation. So it used to be that there was a significant difference between living alone and being isolated. People could get out and about, friends, relatives, and so forth. And then the pandemic stopped some of that. But what are some of the reasons why people are social isolated other than the pandemic?
Yes, I think it makes us think about some of the risk factors. And as we've talked about kind of here a little bit, I'm a geriatrician. So I think people as they age, for a variety of reasons, have a higher risk for being socially isolated. And I think some of that is related to physical health. With physical limitations and disability, it impacts our ability to get out in the ways that we might have done if if individuals didn't experience that disability. But that disability is not just age bound. I think disabled populations that are in younger groups also are at risk for this. We also know people with limited means in terms of lower income levels. They, due to the nature of their financial resources, are impacted by, not being able to necessarily connect with friends and family in the way that people with higher income levels. And that may be related to ability, resources for leisure, et cetera, or potentially, working if they're in middle age, multiple jobs that don't lead them to have time, or maybe for a variety of other reasons. We also know certain, like in some studies, that it supports that men have higher levels of isolation, and that may be due to a variety of cultural norms or life course experiences that lead this group to primarily or have higher risk for isolation. I think language barriers may be one of the risk factors that increases one's risk for isolation. Mental health issues, being people with mental health issues may be stigmatized by other individuals in their community, and that leads them to be isolated from other groups. And so it makes me, there's multiple risk factors for this isolation. And I think our strategies to address it have to also be mindful of the risks that someone may have for isolation, and actually trying to do the best we can to address that risk.
Well, I hope we can replay after this the list that you just gave, because it's terrific. I want to use it for advocacy purposes. We have a terrific question here. It is, what are your thoughts regarding people recovering psychologically after the pandemic? Levels of loneliness will still be high.
Yeah, so I think that the self-insight that people may have. Hold on one moment.
A wonderful example of a parent juggling
sorry about that.
Responsibilities and
sorry about that.
Professional responsibilities.
My youngest one woke up. So where was I?
We're talking about people recovering psychologically.
Oh, definitely. Okay. Yeah. So I think that thinking about recovery, thinking about the impact, I think this is something that we have to deal with. It's something that has occurred in people's lives, and something that needs to be acknowledged. And I think the first point of acknowledgement, if that is occurring within the individual, I think that's an important step to acknowledge that, hey, I've been burdened by this current experience, and I want to do something about it. And so I think that's a great step. I think our with beyond the individual, I think our families, we have to think about, how this has impacted those who we come in contact with or did come in contact with prior to the pandemic regularly, and checking in to see, hey, how are you doing? How are you responding to, how did you respond to the pandemic? And are there things that, as a family member, I can do to be supportive? Our friend networks, checking on our friends who we haven't heard from in a period of time to ensure that they're being supported in the way that they need to be supported. Our communities, like we talked about, churches already, our neighborhood associations, and, senior centers that may have existed and have been very active. Can you reach out to those people who were previously participating and trying to support people where they are at this current time? So I think we have to think about, starting at the individual level and then expanding beyond to really understand, who's being impacted, and then trying to support people to re-engage in the way that is meaningful for them.
Sounds like we have a whole social program that we need to develop out of the awareness of this experience. I just want to go back to part of this question. So, and you had mentioned before, 25% of the older population were living in social isolation prior to the pandemic. unquestionably that number increased during the pandemic. But even if it goes back to the level it was at, 25% is a very significant number, and it contributes to, as you pointed out, to a lot of illness and to some psychological turmoil and also to high mortality rates. But do you think it's going to get worse after the pandemic? There are some people in our field who are saying, oh, it's going to be really terrible after the pandemic is over. It's going to be a tsunami of mental health issues. Do you have a position about that?
Yeah, I think that there's the potential for that, but I'm hopeful about some of the organization that has occurred around this issue. AARP is being vocal on this issue. I think that the work of the Center for Disease and Control, as well as the Administration on Community Living, there's a lot more people who have spotlighted this issue and are working to address it. So I'm hopeful that we'll be able to mitigate the increase in the levels of social isolation and loneliness with some of these efforts that have come about. Just as the pandemic was starting, we were fortunate that the National Academies of Sciences, Engineering, and Medicine released their important report on the impact and opportunities for healthcare systems and organizations to actually do something about this important issue from their perspective. I think the Coalition to End Social Isolation and Loneliness, the important work that they're doing has been important in trying to mitigate these issues during this time. And so all of this is to say that I'm hopeful because of the organization and funding and support of this issue that we won't experience these pandemic levels that I think some people are suggesting and concerned about.
Well, apropos of your calling for this kind of action, it's really social action that would take place to provide more support for people than we have in the past in our society. I'm reminded that AARP has a lot of volunteers, and there is this program Community Connections, which uses volunteers to try to do some of the things that you're talking about. So I would encourage people who are listening to this, watching this, if they're interested in volunteering. By the way, volunteering is good for your mental health.
It is. It is. It's good for your mental health, good for your cognitive health. There's evidence to support for this that we've done right here in Maryland, the Experience Corps, which AARP supports. I'm sure it's taking different forms in the current pandemic, but there's evidence to support that volunteering has a great benefit for our health. And I think, something that we all should be thinking and thoughtful about how we do this. I think volunteering in a way that's purposeful, that provides individual meaning is critically important for not only the individual, but for the organization that you're volunteering for. I think maintaining it being something that's purposeful and meaningful for you as an individual, I think is important because it'll encourage you to continue to participate in that activity with time.
So that reminds me that one of the conversations we had inside the Baltimore Neighbors Network was that people were making calls to older adults on the assumption that they needed help. And we began talking about recognizing that older adults, even older adults in social isolation, could also be helpful.
Yes. Thank you for bringing this up. It's so important. It's so important to acknowledge that older adults are also our assets, important assets in our communities. And there also is opportunity for some older adults to be doing some of these calls for to younger people potentially, or for other older adults. So I think that the community of older adults is there's great heterogeneity, and that we should be thinking about older adults as important assets for our communities as well.
We have a couple of other questions here. What if an older adult begins to experience anxiety or panic when thinking about social interactions due to chronic social isolation?
Yeah, I think this is a real concern. I've seen it in some of my own patients who are even concerned about their families returning to coming and regularly visiting them. I think this is something that we have to work through. Meet people where they are, understanding that concern and try to gradually get them back into some of their routines and behaviors that that previously existed prior to the pandemic. Understanding that this has been a trying and stressful time, people's patterns of behavior have taken a change, and that our behaviors don't change automatically overnight. So, like I said, meeting people where they are, understanding and acknowledging that this is a true concern that exists among some. People see it as a life and death issue. And so understanding that that is a concern for them, acknowledging it as a concern, and then moving from there to see where can there be common ground to help support that person not be isolated.
And perhaps this is a good time to show our slide of telephone numbers that people can use if they're feeling anxiety, feeling depression, really having a tough time. There are resources out there. Let me be frank to say that it is sometimes not easy to find a mental health professional, but telehealth, which maybe we have a few minutes to talk about, Thomas, has made a big difference there. But here are some numbers up on the screen, and you can find this also at the website for AARP Maryland. Most of these numbers are there. So you can.
Yeah, I think these resources are great, and I think these resources are great and particularly meaningful. They're hopefully accessible to people to call some of these numbers that may exist to talk to a live person to help them navigate maybe what's currently going on with them. I think the one that particularly sticks out to me is, talking to someone you trust. I'm hopeful that people have individuals in their lives that they trust, that they can help support their navigation of their current anxiety or trauma that may be experienced.
So we have a couple of other questions here, and we have 3 minutes. So we are not going to be able to say anything much about these. One question is there funding behind some of these organizational efforts? I'll say not enough.
Yeah, I agree with you. That one of the recommendations of the National Academies of Science, Engineering, and Medicine report was that we be more thoughtful about funding these issues. And I think we are seeing some of the major foundations, the National Institute on Health, particularly National Institute on Aging, has increased funding to try to understand and also hopefully address social isolation and loneliness.
So everybody who's listening in, be an advocate. Speak up and say we need to have more funding to address this. But, it's also what you're talking about, Thomas, is really interesting to me because it's a reconceptualization of the kinds of help that people need. And it has this emphasis on social activity.
Yeah.
And I think it's really important for us in the field of mental health, as I am, to think through how we can reorganize some of what we do for people to focus on these social needs that they have. I'm feeling very rushed at the moment because we have 2 minutes left. There is a question, how is it best and safest to reach out to others right now? I think that's a complicated question. Do you have a 30-second answer?
Yes, I think that we can, and we know that we can do things. We can be in person with one another at a distance and safe way. I think there's evidence to support. We've had evidence in our own lives that you can see people in person in a distance and safe way and mitigate the spread. I think many people are vaccinated at this time, and we know the vaccination decreases our risk for getting the coronavirus, and also if you get it, lower levels of hospitalization and mortality associated with this. So I think that we can do this. We can be in contact in safe ways with people increasingly with time. That doesn't mean that we are cavalier in how we interact with people, but I think that meeting people outdoors is always safe, a safe way to approach this. I think, of course, minimizing interactions in large groups, but being selective and thoughtful And also, being thoughtful about, this is, I always think about reopening and re-engagement in community as a thing about trust. We want to interact and engage in settings where we can trust that other people.
Interrupt now. We just heard a bell, and that bell says that we're out of time.
Okay.
And I want to thank you for joining us today. I think you've been terrific, and that it's been very informative. Again, we're grateful that you joined us. And maybe I'll end with this message. If you're not vaccinated, get vaccinated. That's how you can be safe. Thank you very much.
Thank you so much.